Good morning and welcome to second day of this language of anatomy. So today also we'll be learning about another at least say 30 40 new words, right? Now before we start with the words, surface anatomy and inspection. Okay, I'll cover that this point. Right. Now before we really start with our today's subject, now see there were many emails. So what I did is I have just written few of the points over here so that many of the questions they are pretty common, right? So many emails regarding the books were asked. So I thought that let me answer all of them together so that will make things a bit easier. Plus there were many sensitive issues, and yes, I am very happy that at least you are coming up with these matters, because these are the matters, these are the points which actually affect not only your career, but it affects your life. So be ready for some bitter dose also today. Yes, say you'll automatically know. I was just checking that those who have sent such mails, right? And I really appreciate you guys that you can write your personal things also to me, though we are meeting since 1 week only, but you have written so many things about things which you have not even told to your father or your mother. You are not told to your parents, right? Let's start quickly with first the BD Chaurasia, right? The question which was the BD Chaurasia has got several volumes. That's right. BD Chaurasia has got several volumes, volume 1, 2, 3. And all these volumes, they are related to the specific regional anatomy. Regional anatomy. Now you know regional anatomy, right? That is upper limb, lower limb, thorax, abdomen, head and neck, brain, right? So volume 1 is upper limb and thorax, volume 2 is head and neck and brain, and volume 3 is lower limb and abdomen. And there is a fourth book that is for the general anatomy. So that's how they are distributed. Which volume you have to buy? Well, you have to buy, friend, you have to buy all the volumes, right? If not today, tomorrow you'll be learning head and neck also, brain also. So go for the entire set. You have to buy the entire set. Is this sufficient for USMLE or PLAB? The question which was asked. Well, for USMLE and PLAB, such questions, they won't be coming directly, right? They won't be coming directly. As we discussed, our first intention for the first 6 months is not at all exam. Trust me, not at all exam. We'll be making a beautiful foundation, and then we'll be discussing those questions, right? Yeah, that's fine. So then we'll be discussing all those questions, that how they really ask. Meantime, without telling you, I'll keep on injecting such questions which are asked in the exam, but I won't clarify that this is the question from USMLE or this is the question from PLAB. No, I won't tell you, because then you become biased, right? At times we become biased. This question radial artery is asked, so chalo, let me study radial artery. No, they can ask anything, right? So initial 6 months when we are creating the foundation, right, we'll not be talking much about USMLE or PLAB questions. Pattern will follow it definitely, right? But as I said, foundation is vital. Sambulingam for physiology, yes, it is very good, but right, if possible, I would always insist, do read Guyton. Those Guyton is so good, it is like a storybook. Now, yes, for exam purpose, at times you'll find that no, Guyton is like pata hi nahi chalta, means what should we represent in exam, because you know the whole story so beautifully. But this will be very important when you will be in your clinics, because you'll be knowing ins and outs, you'll be knowing all those correlations, right? So Guyton is like an amazing storybook. Sambulingam, no doubt, for exam this is very good. Satyanarayan, yes, for exam purpose, yes, it is definitely a good book. Otherwise, if you want to go for the reference book, so then there cannot be any comparison between Harper. Means Harper is like a Bhagavad Gita. It is superb. But yeah, Harper, Lippincott, they all are very nice, right? They are very nice. Our seniors make a tick mark for exams in these books. Bus. this is what I want to avoid. Because when you tick mark, right, you feel कि अच्छा this is important, you skip at times something which is important from your clinical aspect. So at this point of time, don't worry much about the exam. Give yourself, you have got enough time. Give yourself 6 months for creating a beautiful foundation and then see what happens. Please don't go for any shortcuts, right? That is what I wish to say, because there were so many emails about this. So that's why my wish is this is what I feel like, right? Definitely everyone has got right to choose his or her path, right? Guyton is for physiology. Yeah, I'm sorry, right? Guyton is for physiology. It is for physiology. But if you follow this, yes, you will be very happy, right? You'll be very happy. I'll never be showing you a shortcut, but I'll be definitely showing you something which is good for you. Yes, it is actually more than enough for the university exams. Yes, Vishram Singh also, it is a nice book, right? Both are good books. Obviously, books will be weighing. Moving on to this part, and that is the Chinese or Korean drama addiction. I know this part, right? And initially, I thought that there is only one mail about it. But then, when I was watching, there were 7 emails about the same problem, that you, where you have so intelligently said that they are so addicted to Chinese and these Korean drama serials, etc., that almost every day you are watching 4 or 5 episodes, right? Few less, few more. But yes, I'm just telling one thing. It is in your hand. Why these serials they become popular? Because see, they'll be showing you Seoul, they'll be showing you those cities, right, where usually no one visits. Technically they are quite good, right? VFX effects, they are quite good. And then when we are inclined towards their storyline is at times good, it is good to see. But when it becomes addiction, it's a problem. It's a problem. And now I am say, you all are youngsters, and I'm telling you, there is only one thing, and that is, if there is any important person in this world, so it is you only. There cannot be any other person who is more important than you. Seriously, there cannot be any other person. Because see, what nowadays they are showing all those serials in which they show you all sorts of kachra, right? Literally to increase their TRP. Literally to increase their TRP, they actually show such content. And remember, it is always easy to fall. It is always very easy to fall, right? It is very difficult to rise. So that's why taking advantage of your thought processes, taking advantage of your age, they show you such content, and gradually, if you see, you keep on drifting from your studies. Now that Brahm Gyan comes at a later stage, when suddenly you feel कि was exam is on your head, right? Exam sar pe aa gaya, and then we have not yet prepared ourselves properly. And that day, you regret कि why we wasted so much of time. Dear friends, remember all these things. They make such serials to so that their bank balance improves, their TRP increases, they get the money at the cost of your life. At the cost of your life, because they obviously will show you such things which will lure you so much, right? You'll be so much, matlab itna lalcha ke you'll start watching those serials. They are so addictive, but they are eating away not your time. Remember, they are eating away your thought process, they are eating away your intellect. Because the way it is shown, right, in many of the serials, means they speak bluntly. They don't mind insulting their parents. Now imagine you guys are so good. Means yeah, I'm now, so I can say it with confidence. I'm talking with you. I must have received more than say 800, 900 emails. Not a single email is with any of the insulting point. Not a single email. Imagine you guys are so good, right? So don't spoil your brain, don't spoil. Yeah, today first time. Meet very good. So in that case, just forget that you have listened anything, right? Close your eyes. So please, and because there were so many emails, so I thought that instead of writing so much, let me talk about it for a minute. Yeah, Asmi, that is very nice. Stay away from these. I'm proud of you. Me, Tasmi, Tanvi, Himangi, I'm proud of you. You are away from these things. Excellent. Right? Because there is horrible kachra. Horrible. And the way they market means that's why the addiction is. And you know that all the boys and girls, those who have sent me these mails, I can see that you guys are there, right? So I am talking to all of you. Please send a mail to me also the day you stop watching it completely and fully, right? I'll show you there are much better ways for entertainment. There are much better ways for refreshing your brain, and definitely my promise today I'll surely send you the music because now it is high time, right? I'll definitely send you the music. Okay. Are Deepak, thank you so much. Another thing, feeling sleepy. Correct. It happens. It happens. It happens because you are not taking proper sleep at night. Because these emails, they were from the, means more or less they were in the same email. Both these things were. See, at night. Okay. Do you watch dreams? Do you get dreams? Right. Invariably, if just before few sessions I said everyone dreams every day. Right. Invariably. Now, these yeah. Now these dreams, they are nothing but the reflection of your thought process, right? Reflection of your thought process. And when you watch such serials, when you watch some horrible, I mean horror movies, when you watch something which where there is so much of bloodshed is shown, means seriously, the moment some such scenes come, I literally switch on to something else, right? Switch on to something else. And if the dreams are horrible, just send a mail. Just send a mail to me, right? You need to preserve your beautiful brain very sensitively. It's high time, right? Feeling sleepy, it's like because brain is like brake bagair ki gadi, right? Brain keeps on thinking on and on and on. So actually, the quality of the sleep deteriorates, right? Quality of the sleep deteriorates, and when the quality of sleep deteriorates, it affects your performance. Means I can very proudly say last night, say I was replying to your email still almost 1:30. I slept at 1:30, right? Because there was so much of load, so many emails were there, so I started replying and it was almost 1:30. Still there are still more over 100 emails are left out. I woke up at 4:30, right? 3 hours, but this 3 hours of sleep was such a quality sleep that no worries, because just after few days I'll be running one again, another marathon, right? So that's the thing. Say 3 hours of sleep, but that quality matters, right? That quality matters. So take care of this. Depression, losing faith in yourself. Why? Why? Why are you in depression? Why are you losing faith? Simply because when one said that I'm not as good looking as my friend. Who said so? Who said so? Everyone is good, right? Remember, yesterday only we were talking about, right? Beauty is skin deep. How good is by good you are by heart, that is more important. That is more important. So have tremendous faith in yourself. Never ever lose faith in yourself. You said that I'm losing faith because I'm very ordinary, this, that. No, no, it's not so. Yesterday we talked about that you are winner right from the beginning, right? You are winner right from the beginning. Uh, yes, it keeps on multiplying. So when we say when it keeps on multiplying, right? So let's put something positive. So it will keep on multiplying. How to increase self-confidence? Okay, Jaydev. This Saturday, right? This Saturday, right now, so if we'll start discussing about it, so we'll be ending up in entire time in that only. But this Saturday, we'll definitely be talking about all these matters, right? Depression or losing faith or any of these points, right? Self-confidence. Yeah, exactly. Butterfly can never see how beautiful its wings are. So true. Very true. So the thing is, another point was the self-doubt. So the point is whether depression or self-doubt. Now, regarding this, be ready to listen something very harsh. Because I cannot speak Gali as it is a public platform. As it is a public platform. But the world is so mean. And seriously, whatever the galis which comes in your mind, use that. There is always a cold war. There is always a cold war. And remember, this is your line, right? People won't progress, they won't work hard, and they will make their lines bigger so that they progress. No, no one would do this. They will try to cut short your line. They'll try to cut short your line. Exactly. In Three Idiots movie, the way it was shown, the day before examination, he was putting those pornographic magazines in everyone's room, right? And this is what really happens. This is what really happens. Because see, if we both are talking, right? Now this is like I'm talking to everyone over here one to one. Forget about, right? We are discussing in group. We are talking one to one. And if I'm talking, if I want to take advantage of you, I would never like that you progress, right? Because if you'll progress, आप मुझसे आगे निकल गए, तो then मैं तो छोटा हो गया. Then you won't care for me. So what I'll do, I'll see that you don't progress. How will I do that? I'll keep on insulting you. When I insult you, your subconscious would cry, right? It would decrease your efficiency. So for any of the process, there'll be obstacles, and then I'll be happy. Remember, this is the worst. This is what really how the world goes. What I really want is that you should be such that when you teach, the day you teach anything, teach everything. Whatever you have learnt, teach everything, right? Because then, trust me, this is so true. Teach everything. Because then that day would be like, यार यार कल इनको क्या नया सिखाएंगे, चलो let's study something, and that way you also progress, right? That way you also progress. So forget about the word, right? They are literally no gali. So that's why chup, right? But yes, that's how the word is, right? Don't write, huh? You because you guys are so enthusiastic, you might start writing. So, but think, soch lo, right? The best of the best galis which you can think of. Yeah, YouTube cannot, about some time back, YouTube banned me because I was teaching those pelvis. And obviously in pelvis, there would be male and female organs and it comes in the anatomy. So they banned me that this is what you show, etc., etc. So then I have to put the disclaimer. So now though we have not said any gali, so they can't ban us, right? They can't put restriction on us. So we'll be smart enough. Okay. 3 emails they were We have to use a spacious method. Acha, insults in past. This is there were about three emails on this. As I was talking yesterday with one of my friend, and it was like that past insults, they are like baggage. Arre, kick them off. Do hell with them. Because these past insults, if you keep on remembering, they will actually obstruct your future progress. Your future progress would be affected. ठीक है, I'm with you, right? I understand when you describe that what really happened in the past, but yaar, who cares? Forget na. Chalo आगे बढ़ो. You can't change the past. So still, why are you holding it? Do hell with them. Avoid such people, right? You said that you wrote that they are your relatives. Fine, you cannot avoid it, right? You cannot avoid it, but at least you can ignore, right? Ignore. Because if you don't do this, right, they will actually eat away your future. They will actually eat away your future. And the day which would be the last day, right? Think it like, because this is pretty harsh, but when it is your last day on this earth, that day you will feel कि यार मैंने क्या किया, right? I could have done so much. I could have made difference in so many people's life, but no, I did nothing. I did nothing, right? I don't want that you guys, you go from this world like an insect. Otherwise, all those animals, insects, right? They also khate, pite, sote hain, and then once again the same routine. No, I don't want that. Yes, you earn, definitely you earn, but then that money you should be using every day so that you go one step higher. And the higher you go, you'll be motivating so many people, right? So bilkul, just right, F star 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 the past. Okay, I think that much I can write. Yeah, if we think about it, vice versa, sometimes insult helps to perform much better. Swara is okay, right? Possible. But I'm telling, why to even keep that thing even in the mind? Don't give even that much importance. Don't give even that much importance. Sometimes hate and self-doubt and insults. Yeah, definitely. Yes. Nandini, very right. This self-doubt and insults, they go hand in hand. Very right. If someone is insulting, suddenly you start doubting upon yourself. If someone is telling you, boss, you are fantastic, you are so good, but still that person will doubt कि नहीं ये तो ऐसे ही बोलता है. I am not that good, right? Seriously, F star star star. Don't give any importance to such people. Means throw them out. Classroom feel. Thank you so much, right? You said that we feel like as if we are sitting in the classroom and we are discussing it. Yes, we are coming to our today's topic. Just 5 more minutes, but so many emails are there, so that's why I thought that let me discuss. Work with your studies. Well, again, this is important. See, don't worry about that. You will be decreasing burden on your parents. Your parents, they are smart enough and they have managed the finance so that you can study effectively. At times it happens that when you try to work with your studies suffer, right? And if that is happening, I won't advise you to work, right? Be an excellent doctor. At that point, you'll be earning so much that you will be helping your parents. You'll be making the rest of the life absolutely awesome. How to improve yourself? Yes, this was a question. Surely, in depth, we'll be talking about it on Saturday. Okay? Saturday, we'll talk about it. Fights with boyfriend, girlfriend. Then, if such fights, and in one of the male, I'm without telling the name, I'm telling where that innocent girl was abused in such a bad way, is I'm not right. I'm speaking the entire event. But when I read that mail, I said, stop telling them that they are even your friends. Forget about any other friend. Forget, just throw them out. Right? How can anyone insult you so badly? Right? So no, they are not your friends. And one thing is progress in your life, right? Crack USMLE, reach to that country, go to the highest level. Yes, I'll just talk about it, right? Reach to that level, because then when you are one of the finest cardiac surgeon, you, and when you are finest radiologist, your finest, say, orthopedic surgeon, because at that point you'll be coming into that circle where best of the best people will be in your contact, right? And that is where you will get the choice. So that would be the quality. Someone who is abusing you, someone who is speaking bad about you, and you are constantly in tension, they are not your friends. Forget about boyfriend or girlfriend. They don't deserve even to be called as friend. So just again, out. Don't even give any importance to them, right? Not at all at the cost of your career, yeah. Your parents, you, one side you are telling that I work with my studies so that I can decrease burden on my parents, and on other side, if this is happening, no, keep your beautiful brain crystal clear so that it starts absorbing everything, right? Because there were many emails and it was difficult for me to type so much, right? I hate typing very much, and you must have seen even in my emails also that answers are usually very short, right? But that's why this topic was picked up over here, right? All the personal things, discussions, right? Just send a mail. On Saturday we'll cover everything royally, right? Everything. I deal with insecurity, only one thing: study well, be the best, be the best. Thank you. Okay. Weak fundamentals. This was the email from a very senior batch, and yeah, you are there. You said that you got problems in surgery. Now see, it's very good on your part when you confess this thing. I picked up this question so that it is in the benefit of all your junior friends. See how boldly she wrote, sir, my fundamentals are so weak that I am having lots and lots of problems in surgery. She is in final MBBS. This is what really happens. Now, don't worry, right? Your fundamentals, they can be taken care of. It's a matter of just 3 months, right? Still, you have got 1 year, almost 1 year to go for the exam. That is the next year. So by that time, you can surely clear up your fundamentals. Don't worry, right? Sleep for 12 hours. I should file a lawsuit against you. It's a crime. You sleep for 12 hours? And one gentleman, he said, I sleep for 14 hours. Boss, gold medal is yours. Gold medal is yours. 12 hours, 14 hours of sleep? Are you crazy? And when you say 12 hours or 14 hours, actually you're not sleeping for 12 or 14 hours. It's hardly 4 5 hours. Otherwise, so you are just tossing in bed right left. No, no. I have already emailed you that let me know your problem. Then accordingly I can suggest you something. Surely music, yes. I remember music, because that Yog Nidra music I'm supposed to send you. Surely today, right? Definitely today I'll send. What if I fail? People will laugh. Yes, I'll also laugh. So, क्या कर लोगे? If you fail, yes, I'll laugh. I'll say, "Kare yaar, you are such duffer, this, that, everything." Do you really think so? Why do you care for others? And who are these people Who are these people? I mean, they are the best radiologist, best cardiologist, best orthopedic surgeon, right? From Rice Hospital, from MJ Anderson Hospital, and they will be telling, कि, अरे आर्यन यार तू फेल हो गया, right? Joe Biden from USA will say, कि, अरे यार आर्यन ऐसा हुआ, है ना? It will not happen. Aryan, I'm just for the sake of taking a name, I'm taking, right? Don't feel bad, right? I know you'll be doing excellent. The point is, again, F star 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 people, right? To hell with them. To hell with them. Who are they? Who are they to decide? I give the example. You have got TV at your place, right? With the remote control. Do you give remote control to your neighbors? कि हाँ बस ले मेरा टीवी तू ऑपरेट करना. When you do, you don't give remote control of your TV to your neighbors. Who are these stupid people to whom you are giving all the control? कि वो लोग हंसेंगे. Who are they? See, even if someone is not successful, when they attempt, when they learn, they are definitely at a higher level, right? No worries, yeah. It's not end of the world in case if anything goes wrong. No worries. We proceed and we keep on learning more and more, right? Should I start making notes? Definitely, right? We have learned how to make notes, and you can definitely make your own notes. Exercise routine, well, it's almost half an hour, so even we'll take it on Saturday. In just 10 seconds, if I say, for 20 minutes you jog, jump, you do say jumping jacks, you skip, right, for 20 minutes, so that your heart rate is say 220 minus your age 20, that comes to 200. 80% of 200 is 160. So keep your heart rate between 145 to 150. That would be a very nice heart rate, and you keep on working on it, right? More, we'll talk it on Saturday, right? Other options, if we could manage to clear them, yeah, sure, we'll talk about it. Books I have already told about, right? Today only we started with. You can buy from Amazon or you can buy from anywhere. Yes, there are bookstores also. What food is good for you? What do you like? Right? You are asking me about the food. I'll give you a huge list, right? But anyway, regarding the diet and everything, we'll talk about it on Saturday. Study alone or in group? Well, I would say study alone. And when you have learned the subject well, then, like a boss, explain that topic in front of group. You will automatically be remembering for the rest of your life, right? So, study alone and explain in group. A very powerful method, seriously. Because when you'll be with your friends and you'll say कि चल आज मैं ये topic समझाता हूँ, right? Suddenly your energy level will be at a higher level. Not only that, when you are explaining, right, your brain will be synchronized because one after the other questions would be asked, and you will automatically be preparing yourself for a very nice viva, right? And stage fear automatically goes away. Stage fear is considered as one of the biggest fear. Death comes second. Right? Death comes second. And link for PDF, I'm telling again and again, same thing. Link for all the PDFs, they will be either in the description or the comment section, or I'll be putting into both, right? Both. So you can download this PDF from there. No, it's like all the PDFs, you can get it from here, right? Because here they will be remaining permanently. So anytime you want, you'll be getting it. Yes, there is so many things in super reading, but as I'll get more and more response, right, we'll be proceeding with something more, right? But obviously as needed. All right. Chalo, let's start with our today's topic. Let's learn few more words. Let's learn few more words in our language of anatomy. So you can say this is language of anatomy part 2. As such, there is nothing like part 2, right? There will be one after another sessions. But from tomorrow onwards, we'll start using these words in our conversation. so that you become more and more familiar with it. Yesterday, I read that comment, right? Can we have a figure? So that yesterday I was not having that figure with me, right? So I searched, so that's why I'm keeping it. See over here, it becomes much easier, right? The coronal plane, right? This is the coronal plane. So here it is the coronal plane. Side to side, side to side. This is the coronal plane, which divides the body into anterior and the posterior part, right? Front and back, simple, front and back. So that is one coronal plane. Coronal plane also called as the frontal plane, right? Frontal plane. The second one was the sagittal or the longitudinal plane. So sagittal, this one is the sagittal, right? Here it is, right? Or let's take this, this one, okay, this one. That plane is a sag plane or the sagittal plane. So which divides the body into right half and the left half, right? It divides the body into two halves. And yes, this is the plane which passes through the nose, right? This is the plane which would pass through the nose. So that is the sagittal or the longitudinal plane. Now, when it is exactly in the middle, right, which is exactly in the middle, it is also called as the median plane, right? It is also called as the median plane, right? Median, that's right. Yes, because sagittal plane would be as good as the median plane, right in the center, right? So, and then we learnt what is medial and lateral, correct? Medial is one who is near to median plane, right? Medial is one who is near to median plane. So that's the medial plane, L, and this is A, this is B. So obviously A is more medial, correct? And finally, the easier one, the horizontal plane, right? Horizontal plane, also called as the transverse plane or axial plane. So this is the section. That's the section, say when you will be dealing with the CT or MRI, right? You'll be taking the sections and then you discuss this. So this is like thorax, right? Medial plane. You didn't understand medial? No, there is nothing like medial plane. No, the plane is only median. Medial and lateral, they are relative positions. Kshitij, if you remember, if you were present yesterday, right? That's what we said, that it is one point, right? If that point is nearer to midline as compared to other point, so then it is called as medial, L, right? Medial and lateral, they are relative things. Okay, now we expand our language to next level. Now this time what we are doing, let's say when we'll be discussing upper limb, right? So very crudely, if we draw, that's the elbow and that's a little finger, right? These are the fingers and that's the thumb, right? Very crude. But the thing is, say if the body is here, right? This is the outer one, correct? Parasagittal is nothing but, say sagittal is right in the center. Para means near, right? This is another word. Para means near. So if this is the sagittal plane, all these planes which are either on the right side or on the left side, they are called as parasagittal, right? They are called as the parasagittal. Near the sagittal plane, right? Exactly in the center, then on left side, on the right side, right? There will be several planes. Then you have to consider at what distance. Sagittal is in the center, is the same as the median plane, right? That's right, Harry. You are right. Absolutely right. Yes, parallel, obviously, parallel. Now, when we talk about the upper limb, see, things would change. Things would change. This is medial border, correct? This side. And this outer one, this is outer, right? So things like the body is here. Here is the body, right? Here is the body. So we are dealing with, again, the spammers have come. My God. Yesterday also there was so much of nuisance. Just give me a minute. Let me report this. Just a minute. And let me block this person. Okay. So what I was talking about? So this is the body and this is like outer, right? Say body, this is the hand and the outer side, right? So the side which is near, it is called as the medial border or the medial side. So obviously the outer one would be called as the lateral border, right? Now, if I want to say that all of you check your pulse, put your hand into anatomical position and on your wrist, on the lateral border, right, slightly inside, can you feel your pulse, right? So if this is the hand, right, try to feel the pulse, right? Right? Try to feel the pulse. So that is the lateral border. Now the lateral side, there will be a bone. There will be two bones. One is radius, second is ulna, right? Name of the bones, radius and ulna. Ulna. These are name of the bones. So we'll call this side as the lateral border, can also be called as the radial side, right? It can be called as the radial side, right? Oh my God. These spammers, they are, sorry. So radial side and the ulnar side, correct? Radial side and the ulnar side. Fine. So this is clear. So that's why this pulse will be called as the radial pulse, right? Radial pulse. So that is one. Second, these words proximal and distal. Proximal matlab पास, distal matlab दूर. So easy, right? Proximal means near, distal means far, right? But this P is pass, D is dur. Proximal means pass, distal means dur, right? So when we have got structure A, structure B, and structure C. So here when we say, we can say like this, that B is proximal to A, however C is distal to A, right? Easy, right? So that's how the words which will be used, proximal and distal. Just from tomorrow, we'll start using all these words into our conversation, right? Right now, remember, we are focusing only on the upper limb, right? Upper limb, that is starting from shoulder till the fingers, right? So we talked about lateral border, medial border, radius, ulna, radial side, ulnar side, proximal, distal, and now a newer one. For the anterior, we used one more word yesterday. Do you remember it? For the anterior, there was another word. Can you tell again this one, proximal, distal? Yes, very simple. See, proximal means pass, correct? So, over here, yeah, excellent, ventral, that's right. And here is A, here is B, right? And here is C. So this is far, na? A to C distance is far, and A to B distance, this is near. So that's why B is proximal to A, right? B is proximal to A and C is distal. C is दूर, right? हिंदी में B is B A के पास है, so that is proximal, and C A से दूर है, so that is distal, right? Excellent, right? That is ventral. Now from the upper limb perspective, we learn one more thing. For the anatomical position, it was like this, right? It was like this, standing like this. And yeah, this is plantar. Plantar is for feet. This is palm. So here, anterior can also be said as palmar. Palmar surface, right? Palmar surface. This is palm. And posterior, that would be called as the dorsal. So in upper limb, we have got the palmar and the dorsal, right? Palmar and dorsal. So anterior is palmar and posterior is dorsal. This is true only for upper limb, right? In lower limb, things would be different. In abdomen, it would be different. Right now, we are focusing only on this. Now we come to something which is superb. Now starts the application of it. So these are like upper limb movement. You will be astonished that, okay, we can do so many movements, right? One, costal, it will come in thorax. It will come in thorax, right? When we'll be dealing with the ribs, costal surfaces. So right now, we are just focusing on upper limb. Now, two movements. One is against the gravity, second is with the gravity. Listen carefully. Whenever you want to do exercise, right? Now for those who have asked a question that how should I really, hyoid bone, that is hyoid is over here, right? So it will come in head and neck, right? It will come in head and neck. So we'll not be touching it right now. So talking about the gym. Yes. Wait. Abduction, adduction, all those things will come. For gym, wait. For gym, if you want to be very effective in your exercise, do the exercise against gravity at a slow pace. Yeah, at a slow pace. Because people do dumbbells like this, right? So this is where the kinetic energy is used. Actually, your hands, they are not working that effectively. If you go slow, that power will be multiplied because more and more muscle fibers, they will be involved. There will be more involvement of actin, myosin, filament. There will be more utilization of that calcium, right? So immediately those stores would be exhausted and it will start demanding for more serum calcium, right? That is where, in spite of fatigue, right, when you can work more, so it would improve the efficiency. So the point is, when two surfaces come near each other, right? These are the two surfaces. When they come near each other, it is called as flexion. It is called as flexion. Flexion. You flex, you bend, right? So two surfaces coming near each other, coming near. So when two surfaces are coming near each other, this would be against the gravity, right? Abduction is different. We'll come to abduction, right? We'll come to that. So two surfaces, they are coming near to each other, right? The flexion part, right? And it is against gravity. Now, see, because we are, say, abduction, adduction is also appearing. This is going away from the body is abduction. When it is coming near, it is adduction. It is adding to the body, right? We'll come to that. But this is two surfaces which are coming near, that is flexion, and that's why flexor group is always powerful. This group is always strong. This flexor group is always strong, right? As compared to extension. Because in extension, when you make your hand straight, it is the gravity which is helping. So that's why the extensor group muscles, they are really thin. They are thin strip like muscles, while flexion muscles, they are strong muscles with big belly, right? When we'll be discussing muscle, we'll talk about the belly, but belly is the bulk, that bulk. Muscle, number of muscle fibers, they remain the same. It is not so that once someone starts going into exercise, his number of fibers, they multiply. No, number of fibers do not multiply. They become increase in its size, right? They become stronger and stronger. So that is the flexion and the extension. So this is, now we talk about abduction. Abduct means to take away, right? It's like kidnapping. So abduct. So when this is abduction, going away from the body, right? And adduction, it is adding to the body. So this is away from body, and this is adduction. See, add, right? Adduction. So it is towards, coming towards the body, right? Pretty easy. So that is flexion, extension, abduction, adduction. And knowing these things, it will make your entire muscle group very easy. Because when the name of the muscle would be like, say, flexor carpi ulnaris, right? Flexor carpi ulnaris. So flexor means it is for the flexion. Carpals means these are the bones which are called as carpals. And it is on the ulnar side, so it is called as the ulnaris. So flexor carpi ulnaris, it means that this muscle is into the flexor group. It will be dealing with the carpals, right? Carpals, metacarpals. These are the small bones, right? These are the small bones which are present into the wrist, and they really form the entire hand, right? We'll study it in more detail. But in simple words, when we say flexor carpi ulnaris, so that means it is the flexor group, right? It is on the ulnar side, and it will be going towards the carpal bones, right? And extension is, say, straightening of the hand, right? These two surfaces, they are near. When it is reverse of flexion is extension. So if you have understood what is flexion, this is flexion, bending, right? And when you do this, this is extension. Two surfaces, right? Here in flexion, it is upper arm, right? The surfaces are of upper arm only. They both are coming towards each other, right? Then it is flexion. In case of adduction, one surface is the upper arm, second surface is the body. They both are different. Got it? Right? Same way, extension. Two surfaces are going away, but these two surfaces, they both are belonging to upper limb. Abduction, one surface is upper limb, second surface is body, and they are going away. Perfect? Great. So that is abduction, adduction. Next one is pronation. Pronation, right? Remember, kings pronate. I'll write kings pronate. So kings will say, okay, take this, right? Kings would say this. So this is pronation, and this one is supination, right? So kings pronate, right? So that is pronation. Once you know pronation, supination is easy, right? It is a reverse of pronation. So this is supination, and this is pronation, correct? Supination and pronation. We'll come to that, right? So pronation, supination. Then comes circumduction. Easiest to understand. When you do bowling, right? So that is circumduction. All movements, flexion and then the rotation, right? And then again. So when person bowls, right? When the person bowls, that is what is called as the circumduction, the full-fledged movement. Rotation, right? Rotation, lateral and the medial. To understand it, it is extremely simple. Just flex your hand from elbow, right? When you take it out, right, this is lateral rotation. When you take it in, this is medial rotation, right? So this is lateral rotation and the medial rotation. So see over here, right? See your arm, right? Your arm, it is rotating outside and it is rotating inside. It is rotating outside and it is rotating inside. Abduction and adduction, only one thing. This is your arm going away from the body, abduction. Arm adding to the body, adduction, right? Going away, abduction, coming, adduction, right? Pronation and it is not probation, it is pronation, right? It is pronation. So pronate, right? When the hand is like this, right? You are giving something, right? You are giving sort of say Ashirvad, right? So it is pronate. And when it is like this, it is supinate. It is supination, right? Circumduction is combination of all movements. Very true, right? All these movements, right? When you do exercise as a medico, you should be the best person to define the exercise. The reason behind it is that when you learn upper limb, you know every muscle that who will be doing which movement. So when you want that, yes, I should be powerful into this specific sport, say for example, say boxing, so you know that which muscles will be utilized at its peak for the boxing purpose, right? Even when you are doing general exercise, you'll try to involve all the muscles. So it's not so that in gym you'll be going only for dumbbells, right? Only for dumbbells and you keep on doing it. But a slight change, even if you take a light weight, right? And seriously, if you really try to do that, right? You just go for the top and go for the back. You'll find that combined movement, it is what is called as the complex movements. Complex movements, they will involve more number of muscles and it will be more effective, right? Showbaji wale muscles, they might not develop, but your power, the real power, your endurance will definitely develop, right? So that's the rotation. Now comes the palm, your palm, right? See, for palm, this one, right? This one. Pronation and palmar. Palmar is surface, right? Palmar is a surface, right? Pronation is a movement. When your hand is like this, so when you move your hand like this, it is called as the pronation. Pronation is a movement. Palmar is a surface. True? So I can make a statement like that palmar surface will be facing downwards when you pronate. Am I clear? Right? This is the palmar surface. Palmar surface will be facing downwards when you pronate. So this surface will be facing downwards. Fine. For the hand, right? This is, watch it. This is abduction. This is adduction. This is abduction. This is adduction. You must have noted that this long finger is almost in midline. This is extremely important to understand because we might say that our midline to is passing from here. No, midline is passing from here. But for fingers, things are different because there will be interossei muscles. There will be so many small, they are called as the intrinsic muscle. Intrinsic, right? Intrinsic muscles means they will start in the wrist, they will end in the wrist, and there'll be four fantastic layers, one after the layers, into the hand, right? Now these muscles in combination with each other, they'll be making various movements, because see, our hand is the most complex thing. Yes, when you'll be studying brain, you'll find that in brain, two areas, right? In your cerebrum, two areas, face and hand, they are occupying the largest area, because see, your hands are so sensitive. You can pick up a rose delicately and you can give a punch also powerfully, right? We are coming to all those movements, so we can give the powerful punch, है ना? So that's the difference, that's the point. So similarly, on your face, you can create thousands and thousands of expressions. So that's the reason that the representation into our cerebrum, right, our big brain cerebrum, representation of face and hand is maximum. With back, there is only a thin strip, means with back at the most, what you can just do this much, what else, right? Nothing more can be done. But with face, hand, so many things, right? So that's why the representation is so much. So moving on to our hand, so do remember that when it comes to hands, right, abduction and adduction, they are with respect to, right? We'll write it like this, WRT, that is with respect to the long finger. It will be always with respect to long finger. So fingers moving away from the long finger, away from the long finger, away, that means abduction, away. So here, this long finger would be our central line. This long finger will be our central line, and fingers coming towards it, so that is adduction, right? Towards. Fair enough, right? Rotation is simple. No? See, this is the arm, right? When it is moving out, right, it is rotating out. So it is the lateral rotation. When it is like this, say for example, like this. So this is internal rotation, and this one is external rotation, rotating outside, rotating inside, right? So that is what is called as the rotation. Can it be individual fingers also? No. It is always, this is abduction, this is adduction. Circumduction is balling. It is combination of abduction, adduction, flexion, extension, all combination, right? Now coming to a very fantastic thing. That is your thumb. We are higher than so many animals simply because our thumb has been rotated at a 90 degree, right? The alignment of thumb is different than rest of the fingers. That's the reason that you can really hold the pen, right? You can really hold the pen. You can do so many, because this thumb will be giving extra grip. Thumb will be giving extra grip, and so many things can be done with because of this. Say for example, say when you want to hold something, right, you require thumb. Try to hold it with two fingers. It won't be that strong, because this portion, right, that portion in which there'll be fantastic muscles, and they are aligned in such a way that they generate power. They generate power, right? Eklavya, I was thinking about this, giving this example, but yes, the moment thumb goes, right, almost 80% of the activities, they are lost, right? So that's why thumb is so important. But because thumb is important, that's why we need to understand that its movements would be different, right? Its movement would be different. Now, see very carefully, right? How we talk about it. So thumb, the first movement, which is called as the opposition. It is called as opposition. Opposition of thumb is nothing but doing this. See, this. When you are touching the fingertips, right? Right? Swara, this goes because of the position of all those small bones. There are 8 small bones over here. So yes, many people, they can bend it completely, right? It is exactly like right from the beginning, right from the birth. If you keep on bending the body, say like those gymnasts, so you'll find that even in the adult age also, their flexibility is phenomenal. However, after certain age, once the ossification has occurred, after that, the flexibility is never to that level, right? So yes, it happens. And sometimes it is genetic. So thumb, this touching the fingertips, right? Ramdev Baba can do. So touching the fingertips, that is called as the opposition, right? So thumb touching fingertips. So this is one. Now you'll find that the names will be so amazing. It would be like a muscle named opponens pollicis. Opponens pollicis, right? This thumb is, its Greek word is pollex. Pollex, right? It's called as the pollex. So opponens pollicis, the muscle which will be doing the movement of opposition of the thumb. So that's why it is opponens pollicis, because pollicis means thumb and opponens is the movement. By the way, what Shonak has written was, she looks too pretty, try to catch her. These are the 8 bones over here. These are the 8 bones. Ossification is the formation of bone. Initially, they are cartilaginous bone, cartilage, right? They are soft bones. In the baby, they are soft, right? And then gradually the bone keeps on growing. We'll understand the entire ossification process, right? Actually, we'll be understanding it. But just to understand, it is the process of bone formation, what is called as the ossification, right? Formation of bone. And then gradually the size increases. And then finally the entire that bone, which was cartilage in between, cartilage is pretty soft, it gets converted into the bone, full-fledged bone. It is at that point when the height stops increasing, right? Then there cannot be increase in the height. This is where the radiology comes into picture. Because when you come across a dead body, right? Let's say you come across a corpse, a dead body. So then by taking the X-ray, by looking at the various bones, you can figure out that what is the age of this particular body, right? So that helps you a lot. Regarding all these topics, we'll keep it on Saturday, right? I don't mind discussing on any topic on this earth. Right? If you really check, so when discussing male and female pelvis, yes, I have been thus discussed about so many important things, and it is needed. It is actually needed, right? And there is a lecture called Responsibility as a Male, right? And it is a very controversial topic that at times you feel like insulted, right? Talking to all the boys. But yes, it is needed, because then and then it is your responsibility that your female should be happy with you, right? More when we talk about it. Right now, let's come back to this. So thumb, this is what is called as the opposition, right? This is first. Next, now starts the Viva question, right? Because in Viva, this is invariably shown, asked. Okay, do it, because then you will understand that, let's say this is flexion and extension of thumb, right? Extension of thumb. See this, right? Watch carefully. This is flexion, this is extension. Easy. This is flexion, this is extension. Flexion, extension. But this thumb is at a 90 degree. So this is flexion, this is extension. Right? Flexion, extension. Right? Right? Flexion, extension. But when it comes to abduction, so you might say that this is to like adduction, no? Abduction, right? It is going away. It is going away. Correct? Right? It is going away. Yeah, that's what I'm telling. Because internally there is 90-degree rotation. There is a rotation. When we'll be discussing the bones, at that point I'll show you that how there is a rotation. And that's why due to that rotation, these are the exceptions. So, because over here, when it will come to abduction and adduction, I have to show it like this. Say, this is abduction and adduction. Abduction and adduction. See, abduction and adduction. Abduction and adduction. To be shown like this, going away and coming near. Right? So we know this is special, right? That is abduction and adduction in case of thumb. You have to actually do it, right? Do it so that it gets registered into your brain, right? So this is always easy. Flexion, extension, right? But then this is at an angle. Flexion, extension, right? See, the movement is over here. That's right. And if I just change it, right? This is abduction and coming near is adduction. Abduction and adduction. So over here, once you have understood it, if you just hold over here and then see when you are moving this, see how the muscles, you'll be able to feel the contraction of the muscles. Right? So there will be few muscles which will be internal, right? Just keep in mind the concept. Keep in mind the concept. There will be few muscles which will be internal or I'm sorry, my mistake. Intrinsic. Don't know why it is not internal or external. How the muscle can be external? Bahar thoda na hoga muscle. It is intrinsic. Intrinsic and extrinsic. Yeah, now it is okay. Right? So intrinsic means it will start from the palm and it will end up in palm. So it means there would be bones over here. They'll start here and here, start here and here, right? There'll be small, very small muscles because the area itself is small. Extrinsic muscles, they'll be starting somewhere in the elbow and then they'll be going all the way and then they'll be reaching to the wrist, right? Starting all the way and then reaching to the wrist. So these are, when they cross the joint, they are extrinsic muscles, right? They are extrinsic muscles. So when you write constantly, when you write, sometimes you feel कि अरे यार उंगलियां अकड़ गई, correct? Okay. Put your hand like this, right? Go away. It is going away. So this is abduction. Coming near, adduction. Correct? Right? Abduction, adduction. In any case, this file will be kept on the Google Drive and its link will be into, say, description and the comments. So Harshita, you can always download it. Right? If you are writing something, well and good. And if you're, in case if you're not writing, then also just understand it, that's fine. Forearm extrinsic muscles. Yes, they'll be starting in forearm and then all the way they'll be going towards the wrist, right? So very simple. When the muscle is extrinsic, when it is crossing the wrist, then that muscle would be responsible for bending of the wrist. Correct? Because it is starting from here. When it contracts, it bends. When this extrinsic one, it will contract, it will extend the wrist. Right? When this muscle flexion, when this muscle extension. So what happens what would happen in case if these extensors, they fail for some reason? They fail for some reason, right? Now supply of the extrinsic muscle has gone, right? Maybe because of injury, maybe because of any of the reason. So that means these flexor muscles, they are normal, but they are normal. They are keeping both the things, they are keeping into balance. So these flexor muscles, they have got some tone. So the wrist will remain like this only. The person won't be able to lift his wrist back to normal. Why? Because extensor muscle, right? This is flexion, this is extension. Extension muscles, they are unable to take the wrist back to its original. So this is what is called as the wrist drop, right? Wrist drop. Hand remains like this. Person, even if he tries, right? If he tries, it again falls, right? Because these muscles, they are normal. So that's why they are contracting. But there is no one to oppose them and to take the wrist back into its original state. So that would help you a lot in even deciding the clinical aspect, right? More when we'll be discussing about it. So that's what I said. See, paralysis means what? Paralysis means one particular muscle or region is not getting a nerve supply. When the brain tells was contract, right? So then that muscle contracts and the muscle will be doing some, resulting into some movement. But when there is no control, so that muscle will be flaccid. Flaccid means ऐसे पड़ा हुआ रहेगा, right? He won't be doing anything. So the opposite group will take over, right? Right now, hand is like this because the flexor group is contracting, but the extensor group is also counter contracting. So they both are, say, balancing each other. But over here, right? Over here, if one muscle, right? If these extensor group, right? For some reason, they are not getting the supply, nerve supply. So that means these muscles are paralyzed. So in that case, this flexor group, they will contract and it will put the wrist like this, right? Because these muscles, they will be in constant tension, right? They will be contracting. It's a normal thing. But now it will be contracting. So even if you do it like this, again, it will drop, right? So that is what is called as the wrist drop. So many things are there. That is when the wrist drop occurs because of any fracture or injury to the nerve at a specific point, etc. Right? So yeah, exactly. It is related to Erb's palsy, right? It is related to Erb's palsy, and we'll be discussing Erb's palsy when we'll talk about the brachial plexus. Because in brachial plexus, again, it is so interesting to remember, right? Ram to dur chala. So it is root, trunk, division, and the cord, right? So I remember because someone said that it is about drinking some cold beer. There is a mnemonic like that also. But well, I remembered it like Ram, To, Dur, Chala. Brachial plexus is all those brachial plexus is all those nerves which will be going from here and it will be supplying the entire upper limb, right? So they will be starting from the root. From root, they will form the trunk. From trunk, there will be divisions. And from division, there will be the cords, right? Cords. And that's how, and then there will be the branches, right? I think someone said that to drink cold beer, drink cold beer, something like that. But anyway, I'll be teaching you like this only, right? The mnemonics which I used and I remembered, right? Okay. So this was about the thumb. Now, moving on to some very general concept about, say, muscles. Whenever we'll talk about the muscles, right? Whenever we'll be talking about muscles as such, there is one origin and second which is called as the insertion. Origin and insertion. But now this is the old school. Nowadays, it's called as attachment. Muscle attachment. Explain you the reason within a minute. What origin is? Origin is when end of the muscle is fixed and second end is moving. So then fixed end is called as the origin and the moving end is called as the insertion, right? So biceps is here. It is with two heads over here, long head and short head, and then that is fixed. When this muscle contracts, okay, it is bending at the elbow joint, right? It is bending at the elbow joint. But well, the newer system, it is telling that any of the end can be made fixed so that rest of the body would move. Yes, possible. Yes, possible. And that's why it is called as the attachment. So attachments would be going like proximal attachment, right? See how smartly the things are, and the distal attachment. Proximal means pass. So this muscle, this is near over here, this is proximal attachment, and this is the distal attachment. This is attachment which is dur, and this one is pass, right? So proximal and distal attachment. Anyway, this is just a school of thought, right? That's how they think. But otherwise, when we'll be talking about the muscles, we'll be talking about origin insertion, but do think from this perspective also, right? More when we'll be discussing a specific muscle. When we'll see the muscle will always be having a big bulk, right? Big bulk, and it is called as the belly. It is called as the belly of the muscle. That is the part which will be working. Belly, which is fleshy part, flesh, right? It is the fleshy part. It is a soft part, right? Big one. Then this muscle would be attached to some bone. Then and then it makes the sense, right? Because muscles, they will be working so that body moves at one particular joint, right? At one particular joint. So this is the attachment, this one, right? Let's change the color. This is the one which is attaching muscle and bone, right? Muscle and bone, and we'll call it tendon. We'll call it tendon. Wrist drop is easy just when one group of muscle is not working, right? This side of the muscle is working. This side of the muscle group is not working. So flexor component, it will override and it will lead to wrist drop, right? Anyway, say regarding this wrist drop and then there is so much to learn. So we'll discuss it when we'll talk about the brachial plexus, right? The plexus means group, brachial means hand, upper limb, right? So arm. So the plexus, group of nerves which are into the arm, and that's what we'll talk about, right? There is so much of, but this is a sort of like applied anatomy. Talking about this again, say tendon. Tendon is that structure which is tough, right? Which is tough, and it is between muscle. That's your muscle belly. Between muscle and bone, it's called as tendon, right? It's called as tendon. Do remember, it is between muscle and bone. But your joints, right? Your joints, let's say that's your femur, and that's like a knee joint, right? That's like a knee joint. So this is femur. This one would be tibia and fibula, right? Names, etc., not to worry much about it at this point. But the understanding is that then there will be some bone-to-bone connections. There will be some bone-to-bone connections. Bone-to-bone. There is no muscle in between. They are called as the ligaments. So function of ligaments is to give the strength, to give stability, right? So ligament is for strength and stability. Yes, right? Strength and stability. That's the reason in sports injury, if there is any ligament rupture, so it's a very serious thing. It's a very serious thing, right? And you will find that muscles, they are stretched, right? Muscles can go in spasm. So that muscle has contracted and it is not getting released. Classically, when you are running long distance races, calf muscles. relatively calf muscles are quite weak, right? Hamstrings, thigh muscles, they are very powerful. But those calf muscles, they are gastrocnemius, soleus, they are pretty chota muscle. So they are contracting. But when you are running to the distance of say 40 kilometer, so per kilometer they are contracting about your stride, right? It is called as the cadence, number of steps per minute. So your stride is roughly about 0.8 meter. It means you'll end up in 1200 steps per kilometer. When it comes to 40 kilometer, it is almost 45, 47, 48,000 steps. So that is the point when it can go into the contraction. So when it goes into the spasm, small muscle, and it leads to trouble, right? It leads to trouble. So muscle to bone is tendon and bone to bone is ligament. Perfect. Bone to bone is very right, Siri, right? In body, there will be certain areas where there will be like a sheath, right? Sheath, right? We might say sheet. Well, sheet is a layer, but when in medical, we'll use the word sheath. It is like a sheath. Sheath and sheet means almost same, a layer, right? In other words, it is like a layer. And you know that ligament, right? When it is bone to bone. But when it comes to tendon, tendon is a tough structure, right? Tendon is a tough structure. So from muscle, right, those muscle fibers, they roll itself into the tendon and then the tendon gets attached. But say for example, biceps, right? In biceps, when it comes to, say it's a powerful muscle. Biceps is a powerful muscle. So biceps would say that if I attach my tendon to a small area, right, to a small area, so this much area won't be able to hold such a big muscle. You're getting it, right? If you want to stick something to a very small area, so its stability won't be good. If it is a wide area, so then the stability is good. So that is where this particular tendon, when it gets attached to the bone, it spreads, and it gets attached to a wide area, right? Here is the belly, right? This is the belly, that muscle, right? That's your tendon. But when it gets attached, it goes on the wide area, as if that tendon you have squeezed and you have stretched it so that it can attach to a big area. And this thing is called as the aponeurosis. So if someone asks in simple words, what exactly is aponeurosis? Aponeurosis is flattened tendon. The tendon which has been flattened so that surface area is increased and there is increase in the power, right? The strength. Once again, the tendon is a rolled structure. It's like a cord structure, right? It's like a rolled structure. But when it comes to, say, when the power is needed, right? So such rolled structures, they will flatten themselves and they will connect with a wide area. So it is like a flattened tendon, the tendon which has been flattened, right? So that it can attach to a bigger area and thus it gives you the strength. Got it? Okay. Here is the heart. I know you know these terms very well, so I don't have to worry much about it. Arteries and veins, right? Heart, which goes out from the heart, is called as the artery, which brings blood to the heart. It is called as the vein, right? Obviously from the body, right? So arteries will be supplying blood to the body. Yeah. So here arteries, they will be carrying oxygen, right? They'll be carrying oxygen, but there is exception, right? So arteries, they will normally be carrying oxygen and veins will be carrying the carbon dioxide, right? Veins will be carrying the carbon dioxide and that carbon dioxide will be given to heart. Heart will send it to lungs and in lungs, yes, things would say there would be gaseous exchange, right? Arteries, yes, Shaunak, you are right. Arteries, right? They usually carry oxygenated blood, except we just said that from heart to lungs, right? From heart to lungs, so that artery is called as the pulmonary trunk, right? Pulmonary trunk, or it is an artery. So pulmonary trunk, it carries deoxygenated blood, so CO2, right? CO2. Plus, there is one more exception, right? There is one more exception, and that is umbilical arteries. Umbilical arteries. Very simple logic. Two umbilical arteries are there. Here is the mother, right? There is placenta. Placenta is a connectivity, is the junction, is the connection between both. So that particular artery and the vein. So mother will be sending the oxygen by umbilical vein, and the umbilical arteries, they will be carrying the carbon dioxide back to the mother. So that's how these junctions, they are created, right? This will be explained when we'll be dealing with the fetal circulation. But to understand it, umbilical arteries and umbilical veins, they are meant for the, because see, when the baby is getting developed, so baby is not breathing, so that oxygen is to be brought from the mother. So from mother to baby. Now baby's heart is here, right? So blood is coming, right? So if the blood is coming, this is umbilical vein, right? Umbilical veins, and it is carrying the oxygen from mother, right? Oxygen from mother. And in the return journey, baby has used that oxygen, added the CO2. That CO2 would be sent back to mother, right? That CO2, and that is by two umbilical arteries, because heart is here. So it is practically like with respect to the heart. Things are going away from the heart, so that is artery. Things are coming to the heart, that is vein. So these are the two exceptions. In case of arteries, pulmonary trunk and two umbilical veins, and in case of veins, right? In case of veins, it is once again pulmonary, right? Pulmonary vein and umbilical vein, right? They both carry oxygenated blood. Right? Oxygenated blood. Yeah, in terms of baby, right? When it is in the womb, when it is developing, right? When it is into the fetal state. Very lengthy answer would be there. Blood of mother and fetus is not mixed. Why not? Right? But it is in a very different way, because there is a placenta. So we'll talk about all those when we'll be talking about, say, fetal circulation, that what really happens. In fact, you will be, if I make this statement, you will be very surprised. Baby always gets the mixed blood, right? It is the oxygenated, deoxygenated mixed blood, and then there are some special changes in the heart, so where they bypass very smartly, the blood is bypassed, and then it is utilized. So we'll talk about it. Yeah, one umbilical vein and two umbilical arteries. That's right. Okay. So here are the arteries. So in arteries, some terms use, that is branches. So whenever we'll be dealing with arteries, remember we'll be talking about branches, right? So there is one artery. So we'll always say like branches of aorta. Aorta is our biggest artery, right? Which comes out from left ventricle, right? So left ventricle, which is one of our chamber of heart, from there the aorta comes out, and then we'll be telling branches of aorta. right? Branches. What are the branches of aorta? So they divide, correct? And then they divide. Finally, they end up in very small arteries, and they are called as the arterioles. They are called as arterioles, right? Onto your surface, arterioles. These arterioles, then they once again start uniting, right? And that's where the capillaries will come into picture. These are very microscopic, very small, those capillaries, because it is these capillaries where the exchange of nutrient and the oxygen will start occurring. And then once again they will start combining, and they will come into the form of what's called as the venules. Venules means very small veins, right? But now they will start combining, and like a river, right? Small streams, they will come and they will start merging into the bigger river. So that's why in river we don't call branches, we call tributaries, because they are combining, right? So now the direction is this, everyone is coming and combining, so we call them tributaries. And then we come across the vein, and that vein becomes bigger and bigger and bigger, and finally there is like superior vena cava and inferior vena cava, right? These are the two largest veins, and finally they both land up in right atrium. Right, from right atrium it goes into via the valve, it goes into the right ventricle. From right ventricle it finds that this blood is so totally CO2, right? There is so much of carbon dioxide, so push it to the heart, and there goes the pulmonary trunk. It is going away from the heart, it goes to the lungs. Lungs will do the processing part, right? Carbon dioxide picked up, oxygen added, and then it will say send this blood to heart, right? So now the blood is from body to heart, but it is like lung to heart, right? So it is oxygenated. So that's why pulmonary veins, they will be opening into the left atrium. From there, it will go into left ventricle, and from left ventricle, the big boss, aorta, right? It distributes it into the entire body, right? All the way. Ascending aorta, arch of aorta, descending aorta, that is thoracic aorta, then it goes into the abdominal aorta, multiple branches, and finally it gets distributed. So many, right? All subclavian, common carotid, brachiocephalic, right? All those things, right? Common carotid will divide into internal carotid and external carotid, and these carotid, because they are the direct connection with the aorta, so when you touch over here, you'll feel the power of the pulse, right? They are so, you'll feel the thrust. And though I'm giving a very bad example, right? Seriously, don't feel like giving this example, but still I'm giving for the understanding. In all these serials, when they show you, right, that cut, so that splash of blood, right, that the blood which spurts out is because of the carotid. Because when the carotids are cut, the blood literally it's fired, because 120 millimeter of blood pressure, systolic, diastolic, right? That's the blood pressure. 120 by 80 millimeter of mercury, right? Mercury column. So this 120 millimeter. 120 millimeter is 12 centimeter, right? 12 centimeter. And 12 centimeter is almost 5 inch, right? Because 1 centimeter, 2.5 centimeter is 1 inch. So roughly 5 inch, right? 5 inch. But this 5 inch displacement of mercury, now specific gravity of mercury is 13.6 times than the water. Mercury is that heavy, right? So imagine when this artery is cut, you multiply 13 by 5, 13 into 5, forget about 0.6, right? It comes to 65, it comes to almost 6 feet. Now the blood is not as thin as water, but even if you decrease it by 4 times, still it would be more than almost 1 foot. And that's why the blood spurts out when this is cut, right? In reality, if you really see anyone's carotid got damaged, you literally can't do anything, because 20% of the blood loss, right? and person starts fainting. We have got 5.5 liters of blood, right? 20% is almost 1.1 liter. Now, because this particular artery is in direct connection with the aorta, the moment it is cut, the rate at which the blood is thrown out, right? Even if you apply compression, still chances are very minimal that person can be survived, right? It is that dangerous. That's why these areas, they are really so dangerous, especially during the kite festival. Many a times you'll see that but it happened to my father, right? It was just a distance of not even 1 centimeter. That manja was hardly 1 centimeter away from his carotid. So it's so dangerous. Yeah, physics. So Deepak, I'll many times I'll teach you physics. I'll teach you even the propulsion system of rocket. Yes, and then you'll find कि अरे, it has got some direct connection with the medical. Right? Medical is so beautiful. Oh, we are. Can we discuss for another 5 minutes? Right, just 5 minutes, because it's almost like more than 1.5 hours. Just 5 more minutes. If every one of you say, then we go ahead with it, or we move to tomorrow. Whatever you say. Should I continue? Just 5 more minutes, 7 more minutes. Want to take one important concept. Acha, chalo, very nice, very nice, very nice. You guys are so good. Beautiful. The concept of anastomosis. The concept of anastomosis. Right? Yesterday, I don't remember, but someone just on the in the death overs, I mean, talking in this cricket language, right? In the final moment, someone asked a question, but I just disconnected and streaming, and I saw that question. Okay, what exactly is collateral circulation, right? And that's why I'm picking up this collateral circulation. It is a sort of bypass, but let me explain it in a much better way. The thing what is called as the anastomosis, right? Anastomosis. For this, we'll take one example, right? We'll take the example of elbow joint, right? And going into slightly more depth and see what happens, right? Now here is, think it like, this is exactly like circuit. So when we'll be dealing with neural system, neurology, I'll teach you electronics also, right? By the way, when you have to measure the resistance, those resistors, right? It is one of the electronic component. So there is very interesting mnemonic to remember about what is the value of that particular resistor with the color code, right? BB Roy, goodbye is very good wife. Right? That is a complete color code, in which you can just see the resistance and you can say that this is how many ohms, kilo ohms or mega ohms. Okay. Chalo. But we'll study that thing with respect of electronics when we'll be talking about neural system, right? You'll love it. Achha. So here is our first one. Sorry. Here is our artery. This, we name it as brachial artery. Now we said that brachial means arm, right? It's arm. So brachial artery. It will be divided into two parts as per the bones, because our rule tells that name of the bone, name of the artery, name of the vein, name of the nerve should be same, right? So that we don't have to remember every time different things. So we'll call this thing as radial, correct, and the ulnar as per the bones, right? So radial branch and the ulnar branch, easy. Now this is elbow joint, right? This entire thing is elbow joint. There is one another artery, I'm using different color, right? There is one other artery which is in fact a branch of it only, but now I'm drawing it separately. Its name is profunda. profunda brachii. Profunda brachii. So now you know brachii means it is related to upper limb, right? Profunda means it is big. Profundus, right? Profundus means abundant, khub sara, right? So this artery is getting khub sara blood for the upper limb. Now this particular artery, now starts the real fun. One artery, it comes from this, it goes down. So it is on the anterior side. So it is anterior. It is going down. So we'll call it descending. Descending means which is going down, right? Anterior descending branch of profunda brachii, right? So it is from top, it is going down. And exactly there is one branch. Radial tells कि okay, let's send our branch also to meet this anterior descending branch. So this also sends one branch above. Now this branch is what? Radial, yes, but this radial is going against the current, right? Because blood is going in this direction. So this goes in a reverse way. So it is called as radial recurrent. Radial recurrent, going into opposite direction, recurrent artery, and this is the point where they both meet, they both join. This is called as the anastomosis. This anastomosis is of utmost importance whenever there is any blockage. There will be several anastomoses in our body. This is like a backup system. This is like a backup system. So this backup system is so beautiful that in case if there is any block, no worries, right? Blood will say find its way, and that area would be given the blood supply, because without blood supply, if there is no oxygen, tissue will start dying. That is what we'll see in necrosis, right? As the tissue is devoid, right, it starts dying. So this is one important. Once again, it is like this. From the top, there is one artery which is going down on the anterior side. From below, from the radial, it is the recurrent one, which is going above, right? And they both meet. And this is like a backup system. So in case if there is any block at any point, no problems. Blood will find the blood will find either from here it will supply, or if there is any block over here, so blood can go and supply these organs, right? So this is like an alternative path. There are several such paths, and they are very vital. The last thing why it is said that heart attack, right? Heart attack is extremely dangerous when the person is young, right? When the person is in 20s. Why it is so? You need to radial recurrent emerging from the radial artery and going above. How many paths in total? So many. That's where we'll be learning in detail. This was just one example, right? There are so many such paths. One of the important thing that is for the heart attack, myocardial infarction. When the person is in 20s, right? The coronary circulation or the coronary supply to the heart is like a cashier, right? It is pumping so much of blood, but he has to survive in the blood which is given to its muscles, and that is by the coronary arteries. So these coronary arteries, they are giving oxygen to those muscles, heart muscles. If there is any blockage, right? So then that heart muscles, it stops working. And if it stops working, that is what is called as the heart attack or myocardial infarction. Myo means muscle, cardial means heart, infarction, INFARCTION. It is not infection, it is infarction. That means lack of blood. There are two organs in the body who will never sustain without oxygen. One is brain and second is heart. So if anything goes wrong, it is the injury lifelong. Nothing can be done. Liver can sustain without oxygen for pretty long time, right? Liver can regenerate. That's why one can donate the liver, right? But brain cannot be donated. Heart cannot be donated, right? Heart can be given, but cannot be donated. Okay. But then once again, you'll say, okay, no, we'll give liver. We'll give two kidneys are there, right? So many options. I understand. Okay. So myocardial infarction or the lack of blood. In young, there are no collateral circulation. There are no extra paths developed. As the age increases, as you do exercise, right? So there will be development of so many extra vessels so that blood can trickle down to those muscles by other path also, right? Regarding the heart failure or cardiac arrest or what exactly, this is a very long topic, right? So when we'll be discussing the heart, we'll go into the more details because say heart failure, there can be several reasons. And if you know, there are like SA node and AV node, right? Sinoatrial node, atrioventricular node, right? Then this is bundle of His, then Purkinje fibers. So things can go wrong at a very different level. And say these are all electronic system, right? Literally like electronic system with higher frequency. So someone would be active, someone is not active. So other center will take care. All these things we'll discuss when we'll be talking about the subject. This was just like an entry into the topic, right? So that your vision starts widening, that so many things will be coming up. It is not only, yeah, overview. It is not only like a flat anterior, posterior, superior, inferior, but no, anatomy is one of the most wonderful thing where everything gets combined. And that's the reason what I said is that's your foundation. And on this foundation, everything would be built, right? So to this point, we just finish over here, right? And yeah, and tomorrow we meet at the same time, right? Thank you so much for your patience, and you guys are really good. Thank you, and bye bye, right? See you tomorrow. Have a healthy lunch. Okay, thank you and bye bye. रिवीजन, यू वांट रिवीजन? चलो आज यार खुद रिवीजन कर लो. आई एम ऑल्सो बिट हंग्री. थैंक यू. सी यू टुमारो. बाय बाय. This video will remain over here only. It will remain over here only. I'll not be deleting it. It will stay. Thank you.